Hi, my name is Jay. I'm CEO of Empower Through Health. First, I would like to thank you all for tuning into the watch party. I know that COVID-19 has made it a very challenging time for everybody, and I hope that you and your families are all staying safe and well. We are here for some of the most underserved populations in the world.
We founded ETH because we believe that all human lives are equal. And if you really get to know somebody from a different culture, you'll find that everybody, it doesn't really matter who you are, whether you're born in an African village or born in the suburbs of New York City. Everybody wants three things. They want dignity, companionship, and purpose. We're all pretty much the same on the inside. So how is it that some people can get world-class healthcare? So right now we live in St. Louis. Barnes-Jewish Hospital is just right there as an institution. It's a world-class hospital that's that's worth billions and billions of dollars, where people can get seen by experts in their field and get treated for all sorts of very complicated conditions. Then you go to rural Uganda, where kids still die because their parents don't have $1 to pay for simple malaria medicine. And some people don't interact with the healthcare system at all because it's just not available. So how can you reconcile those two things? And so because we believe that everybody should have the right to live with dignity, live with companionship, and live with a purpose, that's why we founded ETH. By enabling better healthcare to 70,000 people, we hope that we can be an agent for positive change, and we can give people across the world and in our catchment area a chance to determine their own destinies.
Hello, I'm Sarah Eunice, a clinical officer at Mpunde Health Center.
Hello, I'm Natsas Veda, a nursing officer at Mpunde Health Center.
Hello, I'm Namaria Amina, a midwife at Mpunde Health Center too.
17 minutes. 17? You don't know,
In this case, we are assessing.
Okay, here where we are seated, this is a clinical room where we see our patients from. They find a clinical officer here, they see. So the services offered here, we have immunization, we have STI treatment and prevention, then we have immunization, then we do also maternity, then that is we have to do antenatal, postnatal to mothers. Then we also do HIV testing and counseling. Then the conditions mostly treated here, we have malaria cases, which is very high. Then we also have hypertension, which is also common, very common. Then we also have STI, like Candida mostly to women, which is also common. And the challenges we are facing mostly, we need some services like we get patients of anemia and we don't have blood to give them, so we have to refer them for further management. So in case we had that service, then we will be retaining them, then give them to our facility. Then we also have the challenge of diagnosing patients, like those patients who need imaging stuff. Like they want ultrasound scan, they want X-rays, so that we can easily diagnose their condition. Someone comes with a complaint like severe pain, lower abdomen pain, severe, and you have to do a scan to see what is happening inside. But we don't have those services. So these are the challenges we are getting. And people here are friendly. They are good. They are appreciated the services. And the number is increasing. It is not like in the start. So yeah, okay, with the community.
Hi, my name is Scott Blackwell. I'm the field director of ETH, and this is our Mpunde Health Clinic. We began operating last November, and since then we've treated hundreds of patients who previously would have very limited access to health care. So if you guys are ready, we can give you a little tour of the health center. This room right here is one of our inpatient beds. We don't currently have anyone staying here, but as soon as there's someone arrives who needs some more extensive care, of course they're able to be positioned here. This room currently is not in use, but we're planning to turn it into our laboratory. We have some donated microscopes that we think will be very helpful in diagnosing conditions like malaria more accurately than a rapid test. If you'll come this way, and then of course this is right now our waiting area for patients. Here we have some staff members, Zubaida and Yunus, our registered nurse and clinical officer. They're currently enrolling some patients. Behind that partition you can see where treatments are administered, such as injections or vaccines. And then this side we have another inpatient room that's currently not in use. But of course we're always ready to serve our patients when necessary. And then we can go behind and look at the medical store. Alright, so if you'll follow me this way, we have our medical store here, which we keep fully stocked with all the different necessary medicines to provide a basic level of care. This really distinguishes for us from government health centers because it's a very common problem that they face medical stockouts, and we ensure that we never run out of vital treatments for diseases such as malaria, which is a big problem here. And then finally, this room we've recently converted into our maternity delivery room, and so it's, if you'll follow me inside. So this is where we do deliveries and even antenatal visits. We have our midwife, Amina, who's she's very skilled in delivery, and we've already delivered a good number of babies at this health center. So thank you guys so much for joining me on this tour.
The district in Uganda that we serve has 361,000 people, but it only has one practicing physician. So for an area the size of St. Louis City, there's one physician. Imagine that. COVID-19 has also hit Uganda very hard. There are only 55 ICU beds for almost 44 million people in the country. So although Uganda has not yet had many cases, the country has been on total lockdown for the past several weeks. So people cannot work, travel, or often go get necessary healthcare for things like childbirth. In a region where so many people live in food insecurity, this could have catastrophic consequences for many people in the country. Additionally, many people in Uganda cannot access water for hand washing, and the district that we work in has not yet had enough resources to coordinate an educational program for people. And this is in an area where no one has access to TV, and there is much fake news available on radios. Empowered Through Health is trying to address these needs by working with community health workers to form educational programs and materials on COVID-19.
The way we are encouraging our mothers, I encourage my mothers to wash hands thoroughly, not touching people. We are using sanitizer at the facility, but we use Dettol with our patients. We are encouraging patients to wash their hands,
Cover the mouth when coughing or sneezing, if in public or not in public. And another thing, we as health workers, we are using our protective gears like putting on masks and then also gloves.
We are also setting up much needed hand washing stations throughout the region. And we are also investigating the possibilities of helping people with food insecurity as well. We are asking for your support to reach as many people with essential health education and health interventions as possible. Thank you for tuning in, and I hope that you and your families have a blessed day.